welcome to SVG-TV's news for Tuesday, August 9th, 2022. I'm Triska Campbell with the details. Public Service Union says it is prepared to stage industrial action at the Argyle International Airport AIA if management does not address the numerous concerns expressed by PSU members. This disclosure came from PSU President Elroy Boucher as he spoke on a number of issues at a press conference this morning. Boucher notes the PSU has requested dialogue with management of the airport and there has been no favorable response over the last 2 years. The issues on the agenda, Boucher explains, are sick leave, COVID-19 leave, compassionate leave, health and safety conditions of workers, lack of an increase in wages in 5 years, a non-renewal of uniforms, and unfair dismissals. He said the PSU members at the Argyle International Airport are unsatisfied with the treatment coming from management, and the union is ready to launch action on their behalf.
So there's a lot of issues that are occurring at the Argyle International Airport. The union have been patient with the management. And we have been patient simply because the airport at the time knew. We wanted to give time so that all the teething problems can be dealt with. And we did not want to create any major issues given the fact that we are just moving to an international airport. That time has since done. What the management have done is taken advantage of the fact that we were looking at the national interests while giving them time to settle themselves. Now I'm putting this out to the media, to the public, because on the 29th of this month, we should commence negotiations on the collective agreement. But if these issues are not addressed, there will be industrial action at the AIA. We will shut down the airport at certain points in time. And the public is going to be affected. But I want the public to understand taking industrial action is always a last resort. And the Public Service Union have been patient to the extent that the workers themselves think that we are not doing enough on their behalf.
Also out of today's press conference, the PSU president raised an issue with the new recommendations released by the Public Service Commission, which outlines the terms and conditions for dismissed unvaccinated persons who wish to be reemployed with government. The recommendations include mandatory COVID-19 testing at the expense of the employee, as well as mask wearing at all times. Highlighting the staging of SVG's first carnival since the start of the COVID-19 pandemic, Boucher questions the reasons for implementing the recommendations.
So following carnival, following a period in which the same subcommittee would have advised the government, hey, we can have carnival in its fullness. And carnival was held as if there is no pandemic, no COVID. School children, teachers, public servants, government ministers, everybody partied together as if COVID didn't exist. Now, the Prime Minister later said, well, let us look to see if there's a spike afterwards. And if there, based on that, we'll decide. But there wasn't any spike to talk about. So when you come up with this decision, it really confuses the mind. What is the reason behind it? Why are you bringing this in face of what we have just experienced in Carnival?
The President describes the recommendations as draconian and made a call for them to be repealed.
The decision of Cabinet is really nothing but oppressive, tyrannical, and draconian. There is no logical reason for imposing these restrictions on workers anymore. And this position that is held by a group of men and women that have been elected as servants of the people, but who, in my view, have seen themselves as the masters of the people, must be rejected forthwith.
Government has admitted it made an error on a recent memo circulated from the Ministry of Health and Wellness about mandatory COVID-19 booster shots. The memo, dated July 27, 2022, stated that healthcare workers, in addition to being fully vaccinated, must also receive boosters at 5-month intervals after the initial 2 shots in order to be eligible for employment. Addressing the memo at a joint press conference with officials from the Ministry of Health today, Finance Minister Camila Gonçalves explains the memo was mistranscribed following a meeting at cabinet level.
I want to indicate to the public unequivocally that this is not the case. There appears to have been a mistranscribed note from the cabinet when we were discussing the easing of restrictions related to teachers and civil servants. We also decided at the time that we would strongly encourage the taking of booster shots for all citizens, but in particular frontline workers and healthcare workers. And it appears that there was a mistranscription that was sent to that decision that was sent to the permanent secretary, who then faithfully relayed that erroneous record of the cabinet minutes to the healthcare workers, and then it was subsequently reported. But that is not the case. The minutes of that cabinet meeting will only be reviewed tomorrow in cabinet, so we didn't catch it. It went out. But all of us were busy texting one another last night saying, which mandate is this? Who said that? I don't recall that. And the fact of the matter is that it did not occur. We do strongly urge all Vincentians, and particularly healthcare workers and frontline workers, to take the booster. But it is that urging is not in the form of a mandate. It is simply something that we would hope that people do for their own safety and for the safety of the people that they serve.
World Bank has signed off on funds to be allocated for the construction and the outfitting of the new acute referral hospital at Arnesville. This announcement was made today by Finance Minister Camila Gonçalves during a press conference on the Strengthening of Health Systems Resilience Project. The World Bank has approved a total of $64 million, of which $51 million will be used for construction and $13.8 million for the purchase of equipment. The 200,000 square foot facility will house 134 beds, and Minister Gonçalves reveals that the plan is to scale down the services offered at the Milton Cato Memorial Hospital after the new hospital becomes operational.
We will then scale down the construction, the operation of the Milton Cato Memorial Hospital. We're not going to close the Milton Cato Memorial Hospital immediately. We're going to reduce the services there essentially to a children's hospital and a women's hospital, because as you know, or as you may know, we very recently upgraded with the help of the World Pediatric Project. We'd recently upgraded our pediatric ward at the Milton Cato Memorial Hospital, and we think it's in good condition. So we're going to use those operating theaters. We're going to use the Milton Cato footprint to deliver child health care, women's health care, and move most of the other services to the hospital at Arnesville. And then over time, we hope to transition more and more services into the facility at Arnesville.
Finance Minister says construction is set to commence in 2023 and the timeline for completion will be 2026.
We anticipate that this 134-bed hospital will begin construction in the second half of next year, because of course you have to go out to tender. It's an international tender. There are time elements here that we can't control. But the construction of the hospital will begin in the second half of next year, and we hope that the hospital itself will be completed in late 2025 or more likely in 2026. The other elements of the reforms go beyond the construction of the hospital. The eruption of last Fray caused us to do some further adjustments, and the Ministry of Health was very adept at making those adjustments. And we believe now that we have a design for a modern, top-class, state-of-the-art facility. We believe that the facility is going to deliver a level of service never before seen in St. Vincent and the Grenadines. People talk about how much better the modern medical at Georgetown is. Well, this is even a step beyond what modern medical at Georgetown is. We're very excited that we now have the money in hand with this World Bank approval to commence construction.
Meanwhile, Minister of Health Sinclair Jimmy Prince has described the new hospital as a game changer for the country's health sector. Minister Prince says the Milton Cato Memorial Hospital has encountered a number of challenges over the years, and the new acute referral hospital will address the gaps in the healthcare system.
It's a 19th century building which now houses the MCMH. It has major defects which make us vulnerable to natural events such as hurricanes, floods, heavy rainfall, earthquakes, and other natural disasters. And you've seen before how we have been affected by these disasters. There is, in addition to that, a woeful lack of space for expansion and storage, or even to facilitate the flow because of the layout of the hospital itself, the flow of patients and workers alike. It is, of course, located in a floodplain in the heart of a busy urban area, which present concerns themselves, and you know where that is, and you know that that area has been developing over the years. In addition to that, there is a need to expand the secondary care in St. Vincent and the Grenadines, and at the same time provide levels of tertiary care, which we now seek overseas at considerable cost.
The minister reveals that there will be an expansion of the existing services and the introduction of new services at the Arnesville facility.
And the existing services, and introduce new services in keeping with the disease profile and the aging population here in St. Vincent and the Grenadines. And the services that we intend to expand and introduce at Arnesville include cardiology, interventional and preventative, diagnostic and better management of persons with heart disease and other related diseases, neurology and neurological services, including enhanced acute stroke care, and you know how that affects us here in St. Vincent and the Grenadines and the prevalence of that in this country. Endocrinology, including diabetes, thyroid services, maybe the largest killer in the St. Vincent and the Grenadines, apart from cancer, must be diabetes and other NCDs. Enhanced ophthalmology services, cardio, thoracic surgery. We have abdominal surgery, orthopedic surgery, joint replacement, etc. Diabetic ulcer cases and limb salvage. All of these would be done at that particular hospital, which we do not do now to the extent that you could call it tertiary.
The Emergency Operations Center Design and Management Workshop, hosted by the National Emergency Management Organization, NEMO, in collaboration with the Ministry of Finance, officially opened today. The main objective of the workshop is to provide an overview of the functional design and organization of a National Emergency Operations Center that can be immediately applied to improve emergency preparedness, response, and recovery for the people of St. Vincent and the Grenadines. Addressing the opening ceremony, Director of NEMO, Michelle Forbes, says that the workshop forms part of NEMO's overall operation.
To coordinate any national response for hazard that requires a national disaster system to be activated. And it is one of the areas that was highlighted following the last volcanic eruption, when we had to activate in this same room as part of the Emergency Operations Center management, coordinating and command and control of the event. And coming out of those recommendations, we identified that training in design and setting up of the Emergency Operations Center is key, because it was an emergency that we had over 3,000 persons on any given day in the early stage of the emergency managing response. And many of those persons who came forward did not have the knowledge of how do we operate in an Emergency Operations Center. And I know we have a few new faces here today who it would have been the first time for them operating. So I want to encourage you during these 3 days. We are looking at how do we design an Emergency Operations Center. We are hoping also to expand our building to redesign our Emergency Operations Center. And your input today over the next 3 days will actually give us some insight as to how can we go about doing it better and reorganizing to meet the changing demands and the increasing events and complexity of the emergencies that we are facing here in St. Vincent and the Grenadines and the region.
Speaking of the recent impact of natural disasters in Bekwai, the director outlines the need for a full involvement in the design and management of emergency center.
Today, we welcome not only participants from key agencies, but also participants from the Grenadine Islands of Union Island, Mairo, Canawan, and Bekwai. Just over a week ago, if you remember, our District Disaster Committee had to coordinate the response and initial damage assessment on Bekwai, where over 25 homes sustained wind damage. This clearly demonstrates the importance of all involved to have the knowledge of how to design and manage an emergency operations center.
Meanwhile, Permanent Secretary in the Ministry of National Security, Hudson Ned, says the training aims to develop and advance emergency response in the country.
Our experiences will not be bruising, but more building. And I think that opportunities like we are going to experience in this workshop today is going to be very critical and necessary as we advance and as we continue to develop. We say tweak, or maybe we say refine, but the workshop, it is my expectation that this workshop, given the outline of the topics that's going to be discussed, that these would lead to a better understanding of responsibilities. So the government recognized its responsibility to invest in disaster risk reduction and hazard mitigation and climate change adaptation projects. The mix of innovative initiatives include, but is not limited to, human resource development and significant work to bring to fruition critical references such as training.
As NEMO continues its disaster preparedness, a number of district disaster communities and groups have been set up in villages across St. Vincent and the Grenadines. Kenson Studdard, who is the Deputy Director of NEMO, outlined NEMO's disaster preparedness plan during an interview on NBC Radio's Face-to-Face program.
We think that that arm of the emergency management structure is the most critical. Why? Because at the community level, we persons working at the office, right, would not be able to respond as quickly as we would like to in the event of an emergency, whether it be a hurricane. We saw what happened in the eruption of the La Soufrière and so on, although most of those communities were evacuated and so on. But oftentimes, communities in the north could get cut off.
Right.
We also have that situation, unique situation, where we have a number of Grenadine Islands that we are responsible for. And so there's, in a sense, remote. It takes a while to get down there. So we want to position these groups and we want to train these groups to bring them up to a certain level so that they're effective, they're able to function in our stead. And so that's the aim of the district disaster group.
Studdard says a more holistic approach is being taken to improve community disaster preparedness and management, and he also notes that work is being done to bridge the existing gaps in the north and south of the country.
You know, when you hear about communities, you might think about a geographical
area,
space. But we would like to broaden that. Over the years, we have evolved as an organization, and disaster management has also evolved globally. And we have to take a lot more things into consideration. So your workplace. So you could have a business community.
Right. Mm-hmm.
Okay, your schools, and so on. So we have expanded the program over the years to encompass the different facets and components, right? So at this moment, our scope has broadened, and we have taken a more holistic approach to community and community disaster preparedness, disaster management. Okay, so NEMO program encompasses what takes place at the school. We support the Ministry of Education because they have what they call a safe school program for schools. Mm-hmm. And we're now trying to branch out into the business community and really focus on how can we build that sort of resilience in the business community.
In other news now, the government of St. Vincent and the Grenadines has set aside $3 million EC to be spent on road cleaning program. The 8-day cleaning program began today, Tuesday, August 9th, and is being overseen by the Roads, Buildings and General Services Authority, BRAGSA. 6,000 persons are to be employed in the island-wide initiative across all 15 constituencies. This will include 491 gangs and 1,000 jobbers who will be responsible for the cleaning of roads and drains, as well as the cutting of trees. Contracts will also be given to over 100 truckers and conductors. BRAGSA is appealing to motorists and pedestrians to take the necessary precautions during this time. The program, which is a collaborative effort between BRAGSA and the Ministry of Economic Planning, will be undertaken as part of the labor-intensive temporary employment program, which falls under the Volcano Eruption Emergency Program in that ministry.